Good afternoon, everyone. Hope you're good. Welcome back to Chewing It Over. I'm still Jack Chew and coming to you weekdays 12:30 till 1 o'clock, except on Tuesdays. You've all been noticing now it's been a few months whereby you've had a guest host on Tuesdays. And thank you for, I think maybe not every week, but fortnightly, I get messages, both public and private, saying, why do you have to do most of the shows? Your guest hosts are better than you, Chew, get off the stage. And I know you're right. It doesn't make it any less hurtful, though, of course. But no, I enjoy it, and I enjoy the fact that that is a compliment to my brilliant guest host. Leanne was on yesterday. Her first solo show, you might have noticed, and she smashed it. It was brilliant and very funny because I nearly just put I've got my little name tag on there because we've got a guest on today, and I nearly just masqueraded as Leanne. So maybe I need to sort of bask in her glory a little bit. And when she does a show like yesterday's, maybe I will come to you and pretend to be Leanne for a bit. So without further ado, I want to bring you my guest who's on today. You'll have seen in the titles and the description for today's show that Gita Ramdharry is speaking with me today about the culture of physiotherapy and, well, culture and physiotherapy. I've titled it like that on purpose, and you'll notice in the description that it was almost, when I'm writing it, I'm trying to be thoughtful and think that some of Gita's work on this has been speaking about the culture of physiotherapy, and there's a distinction from the way in which culture influences, or in this case, should influence physiotherapy sometimes more than it does. She's written a brilliant blog on this recently in prep for this, as well as the fact that it's been long awaited. So we've been hoping to get her on the show for a little while. So I'm glad to, hopefully, in the click of a couple of buttons, bring you Gita. Gita, can you hear me?
I can, yes.
Fantastic. Well, thank you so much for joining me. Could you just introduce yourself first and foremost to the listeners?
Sure. So I'm a physio. I've been a physio for 26 years. And I'm currently working as a consultant allied health professional at the National Hospital for Neurology and Neurosurgery. I sort of have a clinical academic role because I'm a associate professor at UCL as well, an honorary position where I do research. So a bit of a mix. And I've been an educator for 11 years as well at St George's. So some of my reflections come from that experience as well.
And I think that certainly came through in your writing, as well as some of the social commentary that I've experienced on Twitter before you wrote the blog, is that you're someone that wearing many hats professionally, but also you've been open about the fact that wearing many hats personally within your own identity has helped to influence your take on some of these matters. So you just tell us a little bit about that and what's made you feel you want to speak to some of these issues more recently.
Yeah, sure. I mean, I was brought up in the UK, daughter of immigrant parents, and I'm actually mixed heritage. My mum's Irish, but my dad's from Mauritius, but originally of Indian heritage. Right. So, I've grown up in this country, and I trained at UEL back in 1991 was when I started, and we were one of the more diverse courses at the time. And when I talk diversity, it means there were 5 men on the course out of 52. And I think there were 5 or 6 of us who were from Black, Asian, minority ethnic backgrounds as well. I've observed things along my 26 years. And I think sometimes I haven't always recognised, particularly early on, and I was younger, and also I think these things weren't spoken about so much then. I didn't always make sense of it, but I suppose I've got many years now to reflect back upon, and also with my academic interest as well, exploring things a little bit more. You can never quite leave things alone as an academic. You're always trying to get to the root of things. And also for me as well, I got involved with the CSP BAME network probably about 3-4 years ago now, and then of course we've had a tumultuous year since the murder of George Floyd, and how it's made us examine ourselves as individuals, but and as institutions as well. And I know the CSP is going through a lot of evolution with that too. So that was where it started to come from. Where I originally started to think about this way before then was when I was teaching at St George's. We used to teach a module to the first years, the medics, physios, nurses, in one big thing around culture. It was quite dry, and I remember we gave lots of definitions of culture, and you could see there were 300 students. They were all either texting or falling asleep. So it was a little bit unsatisfactory. Years later, I was teaching on an MSc module, and it was one we did on culture, sport, and exercise, and that's when I started to explore actually the culture of institutions, sporting institutions, which was very interesting, and how things like ethnicity, gender, sexual orientation were viewed from certain institutions. And that was kind of when it first started. It's when I first started to read around, but then left it for a while, but had come back to it since last year.
And I think, like you say, it's been such an interesting and tumultuous was, I think, the word you used, which is a great one for the year that's been, especially with regards to some of the sort of racial awareness particularly, but also, you know, the intersectional analysis that's been applied to pretty much everything. And your blog speaks to a couple of examples that kind of offer this crossover where, and it's really lit the touch paper and quite rightly gone what we could consider viral in terms of physio circles and healthcare circles in many ways recently, and it's only a week old or so I'm sure it'll go further. But it's just that I was just saying, we just briefly spoke before we went on air about the fact that one of the reasons I think it has is that there's often various proxies that get used, but really someone hasn't spoken directly to some of the cultural examples. Like, you weren't shy to bring forward some examples that you've experienced. And I think one of the things I wanted to talk to you about really is that, what do you feel, can we start maybe on the sort of culture of physiotherapy, as if distinct from, even though we know it's not, from sort of the ways in which culture should or does influence physio. But I just wondered what you see as being interesting about the culture of physiotherapy as you describe it.
It's sort of professional cultures, and each profession will probably have, will have their own culture, and it's probably been explored in more depth in others. But if some of the definitions I put on the blog, and there are many out there, but one of them is about, it talks about cultivated behaviour and cultivated experience, which is learned through social learning, and of course, when I reflect right back to my training days and also training other physios as well, a lot of that learning that goes on isn't just your anatomy, your physiology, your techniques or whatever. It's also about wearing the physio identity, having that as your little banner. It becomes part of our identity, doesn't it? But we, in a way, we're expected to behave or be a certain way in order to own that. And when I first started looking at it, there was a great paper by Meryl Norris at Brunel and Pascal Alate, where they looked at this, and what they were talking about there was to do with our training. We still have very much biomedical emphasis on our training, and that continues into, if we're working in NHS institutions in particular, so certainly a lot of our institutions, we bring in biopsychosocial and sort of humanism with it into some of our AHP professions a little more perhaps, but it's through that learning and how we're socialized to become physiotherapists through our training. That's what Meryl and Pascal talk about in their paper, and I certainly reflected and thought, yes, I can see that's happened. What I talk about in the blog as well is that as a very junior physio, and this was back in 1995 when I first qualified, and even before that as a student, I assimilated. So it's complex for me. I'm of mixed heritage, but people see me and see Asian, and they see my name and Asian. So I'm racialized as Asian. I identify as Asian and I identify as mixed. That's okay, because it's where people put me in a box, but I'm comfortable with that. There's lots of tick boxing, as we know, with how we identify. And so I realised that I was able to socialise more with my peers when I lost some of my Asianness, if you see what I mean. So as a junior physio, and I cut my hair very short, and there's lots of pubs going and that sort of thing. For me, that wasn't so much of a problem because my family are Hindu. Alcohol is prohibited, but there was still, elements of our culture that I suppressed, I think. And it's only as I've got older and a lot more confident as a person, and that I've brought a lot of that element back into how I dress and how I identify and that sort of thing. But and that assimilation, so it's not that assimilating into the dominant culture is not inclusion, it's giving yourself over to the dominant culture. And and that culture was about belonging in that physio department, being part of the profession, being identified as a physio, not sticking out. And you know what it's like when we're youngsters, we just want to belong, we want to be part of the group, and because that gives us a sense of belonging. But it was at the expense of who I was. So that's where I think think I was starting to become aware of the culture of the profession. And then it was also observations to do with interactions with patients, which I also reflect on a couple of instances there. One I didn't put in the blog, but one that very much sticks in my mind, where I had a bit of a light bulb moment as a senior 2 physio, and we were very lucky to have a lecture and in service from the brilliant Mick Thacker, who is fantastic. And he, at that time, and this was in the late 90s, was already starting to push the language on pain. And he was saying, you have to understand that in different cultures, different ethnic groups, different languages, there are many different words for pain. And I heard some slight, rustling next to me and some of my colleagues, and I overheard a couple of attendees going, well, that figures. And also I remember, I've mainly worked in London, and the label that was given to patients of the normal for Tooting at St George's and normal for Camberwell when I worked at King's. What did those people look like? We all know what those people look like. And that realization, when I heard this comment, I was really hurt, actually, because it suddenly occurred to me, I've got my 2 grandmothers at the time, sadly not with us anymore. One of them is my Mercian grandmother in a sari, and my other one is my blonde Irish grandmother. Would have been treated very differently by my colleagues who were sat just next to me. That was a bit of a light bulb moment, and that was just, there was no challenge to that. It was just, and I was not confident of my time to be able to challenge. But it's something that sticks with me as a pivotal moment in my understanding of the profession.
And so that othering that you experienced there of distancing you for arbitrary reasons from what would be norm culture, do you see that as being something that is societally inherent, or that there's something distinct about physiotherapy or in healthcare or whatever it is within that tiering system that is influencing that negatively?
I think what's been interesting with the blog is that it's become apparent it's not just physiotherapy. There's been quite a few dietitians have commented, and OTs and other AHPs, and a couple of nurses as well. So I don't think it is, but of course my perspective comes from a physiotherapy because that's the profession I know best. And I haven't looked at the literature in the other professions, to be fair. So I suspect it isn't. And also physiotherapy, I mean, I work in the NHS, but I've worked in universities as well. We sit within an institutional culture. So it's also what the institution's expectations are of us and how we behave and interact, and also the patients who access our services, which is another thing that I find very interesting in terms of what I put a diagram in the blog of what constitutes a good patient, or who are the people who are seen as being uncooperative, no rehab potential. It's where we are letting certain groups down because we are not taking the time to be able to have the cultural literacy or the cultural competence. I don't like that word. I don't know why, but I don't. But the cultural literacy to try and understand why somebody may need another approach to be able to engage with us.
Yeah, I think that stuff definitely. Call it what you will, cultural literacy, cultural competence, just generalised awareness of what other features affecting someone's personhood might be contributing to your interactions, and also not to neutralise yourself in that, right? That's sometimes what came through really strongly in your blog is this notion that sometimes because it's the water in which we swim, and therefore sometimes we might not notice it, there's something implicit to an existent cultural baggage, shall we say? Again, not a good term from me, but if you're interacting with someone, there's not something cultural going on there, and yet here I am, neutral, objective. That's something that we should have matured. And most therapists, especially I hope my audience, you can imagine, I'm going to bias it and say that they're more thoughtful in terms of at least the way in which we now come at things to try to elicit a thorough narrative, and to also know what you're bringing to that, and to have it more conversational rather than it being like the sort of the more obvious power dynamic of the subservience of a patient coming with their hand out, hoping for some care delivered to them. You know, it's more cooperative. But sometimes those cultural features are difficult to sometimes weave in there. I asked Melrose Stewart when she came on Physio Matters not long after the George Floyd murder, and I asked her about whether she sees this as being our. And it's not easy to differentiate, I guess, but it was like, is this our corner of the wider social issue, or is there something quite unique, or a unique version of it that is inherent to physiotherapy? And I struggle to maybe know, you know, reading your blog, I struggle to know your take on that.
It's multi-layered, isn't it? And there is an individual response. It's like I say, you know, everybody has their individual culture base and how they're brought up, how they're socialized, their education, etc. So there's that element. There's the professional element in terms of how we're educated to inform that development of the person. But then there are the bigger cogs as well. And this is what people have been talking about in terms of structural issues and institutional issues. And then, of course, there's been big discussions about institutional racism and whether or not it actually exists. Interesting. And so I think it is multi-layered. So coming at it just from one lens isn't correct. I think we have to be able to appreciate the bigger picture. And I think that's hard for us as individuals because, you know, many of us will want change in it. We're very responsible in how we have our individual interactions, but we're still sitting within, a profession where we still don't have the best diversity statistics. It's getting better, but it's a bit of a slow process, and perhaps in institutions where we're seeing glass ceilings for people over band 8, and if you think about the NHS, the WRES figures are quite damning, and so we're still within that context of a bigger structural issue. It's interesting actually because this month, I don't know if you've seen the Journal of Humanities and Rehabilitation. It's quite an interesting American journal. And there's a very interesting qualitative piece from Canada looking at the experience of Black and ethnic minority students, not unlike the one that was done by John Hammond and the team and Muriel again a few years ago. And one of the reviewers, a guy called Brian McCandy's, commented here, and he makes states that even though we're trying to understand individual experiences, the structure of as physical therapy, as he puts, but the structure of physiotherapy community or practice is not often examined itself. We would look at individual experiences and an individual's behaviour, but actually, what are we doing as a profession? What is it about the actual community? That's where some of the responses to the tweet and the blog have been very interesting, because there's been quite a few educators have actually come in and said, yeah, we're looking at this. Actually, we recognise there needs to be some so more inclusion of not just non-white of non-white bodies. And I mean, electrotherapy. I'm old enough that we did electrotherapy of the most barbaric kind when I was training. But I remember then when they were talking about erythema, I was thinking, but how would you recognise erythema on my dad's skin? My dad is very dark skinned. And there was no reference point for that. And even when I asked them, you know, what would you be looking for on a person with a dark skin colour, and they weren't able to answer that. I mean, hopefully we're not doing infrared and things on people anymore, but that's another example, I think, where, and it also I make only a brief point because I think it's a whole other area to look at, is actually is the heteronormative dominance as well in our teaching and training, which I think is now being challenged by some great advocates for looking at transgender health. So that again, hopefully the tide is turning there as well.
I think what's interesting then, sorry to talk over you, I think there's a slight delay, I didn't mean to that. The modalities change, certainly, you know, you mentioned electrotherapy and stuff, but then also when we were doing injection therapy, you know, understanding the higher, there's a risk of discoloration on superficial injections, full stop, but the consequence of that on darker skinned people is going to be far more significant, and therefore, you know, something that needs to be considered, and that not having a mature conversation about those things, then, both with the patient, but also as we come to understand it, and therefore the importance of good technique and all the things that can help to try to mitigate those things as far as we can understand the mechanisms. That's important. And I think I encountered it a little bit as well recently. We did an event, Therapy Live. We did pelvic health and some of the cultural competency issues that surround that with regards to the the colour of bodies in textbooks and the consequences and sequelae in the medical professions. It was just a fascinating thing, and we had midwives on. And I think that whilst we try to aspire to better ourselves on this, I think what I find is that the analysis, we can draw on statistics, we draw on whatever the evidence can bring, lived experiences as experienced by anyone that wants to bring in that subjective element, as well as then, of course, they're not distinct. It's not got the data here and the lived experience here. Of course, we've got this melting pot of evidence that emerges. I think that sometimes where the contentions lies, then what to do about said findings. And one of the things I wanted to bring with you is that the examples that you used, and you mentioned it earlier as well, with regards to, let's just pick one of them, and there's many, and I encourage people to not use this as a proxy for the blog. Go and read the blog. But you'd mentioned earlier about say alcohol or the culture within that, and I think that when it comes to those sorts of sensitivities, do you see as a route to being to integration and inclusivity that makes those sorts of things compatible, or do you think that actually, if you're having a social in your department, or that you're recognizing that therapists are becoming compliant with, say, a doctor's mess culture in a large teaching hospital, that the only way to make those things appropriately inclusive and compatible with, say, those that don't drink, or Muslims being the obvious example in terms of the sort of data on this, is the only way for that to be truly inclusive, is for it to not take place in those venues and for alcohol to be part of that culture? Or do you see them as being more compatible than I'm describing?
I think it's very much about not being frightened to ask what's okay, and I think that comes with I think why I don't always like the cultural competence label is because it's people do cultural competence training, tick. Right, I understand everything now, and you can't because I mean I guess I come from a different culture, but I'm not familiar with the cultural intricacies of people from other groups or other countries or other religions. So I might have some insights for some, but definitely not universal. We can't know it all. But I think if people ask if that's okay, and I had before COVID, I was able to have a gathering of my research team, and one of my research team is from Saudi Arabia, but I wanted to make sure that they were comfortable with what they were comfortable in when they were coming over to mine for a barbecue, and so in terms of halal meat, and that we will be providing all sorts of drinks, but are you comfortable with this alcohol there? And that was all fine. We actually had a really lovely evening, but I made the effort to just find out what somebody was comfortable with beforehand. And it's not about sort of scrapping everything, but it's just being thoughtful about the people that could potentially be excluded, and just finding out, it might be that some people that don't have experiences and are think that an establishment like a pub is going to be something very different to the reality, so it's just sort of being curious and being thoughtful in terms of finding out how people feel about it.
I mean, this is the example might be a bit too close, so feel free to not really want to get into the detail of it, but had that have been a problem for said member of your team, would that have meant that, so was it a precursor to this is happening, I want you to be comfortable, or would there been, had that have been something that, that would be a red line for me if there's alcohol present at said barbecue? Would that have, what behavior changes or changes to that event would have occurred?
Well, I like my team to be sort of very, they're quite close and inclusive, and so if that was okay for the others, that that if we had alcohol, it would be somewhere else, or we didn't have it at all. But I've not had to deal with that scenario to know how others would feel about it in my team. But if there's an opportunity for everybody to join in, if albeit modified, rather than excluding one person, that would be my goal.
I think one of the things that tickles me when I was first, it was my very first rotation of my first job down in Margate in Kent, which was amusing because everyone asked me if I could provide a translator, which was an interesting experience for me with my accent down there. And on 2 occasions, they weren't joking; they genuinely were needing me to slow right down. But I had a team in which I remember putting my first annual leave request in. And I was nervous because it was a Christmas one and I was a long way from home and stuff, and I wanted a big chunk of time off at a time where it was going to be busy. And they chuckled at my nerves because they said, "Jack, you could have Christmas off, mate, no problem, but we need Diwali off," because the majority of the team were, they were saying, if you cover us for Diwali. And it just made me realize that I'd not realized just how actually that level of our diversity was only going to help with those sorts of things, because we had different cultural landmarks of which we were all, and it was a great experience as well for me to see that and to be invited to many of those celebrations later down the line that year. So that is an example. I always remember it as being an example of how one thing that would have been silly is if we weren't to talk about those sorts of things, not just because of annual leave and sharing it, but also just that the experiences and differences there were really relevant and really interesting, and never something that needed to become between us. And that's the goal, isn't it? And I think when I finish on the blog, we're saying that actually discussing this thing isn't controversial. It's not different. It's where it all becomes automatic, and there's true equity. That's where we want to get to. But I think that we do need to be looking wider at what we are doing as a profession, that's as individuals influencing the profession, but also those leading profession, which, as I say, the CSP are trying hard to look at this with their EDI strategy, and talking with us quite a lot in the different networks. It's not a short game. It's going to take time, but I think what really heartened me with the response to the blog is that people are actually really willing to examine the profession, examine practice within their own departments, because departments have their own culture as well. I've seen that myself. I'm sure you have. You work in different departments, and they all feel a little different, in terms of who's there and what's done. And the fact that people are willing to examine, and it's that reflection which helps us to make these realizations and then put those things into place to be able to instigate change for the better. And let's see how we go over the next year. There's been a lot of change over the last one. I think it's interesting because it's hard, isn't it? So when we talk about culture, and then we talk sometimes about subculture or professional culture, and it's almost like these are always layered, and that one isn't without the other. And something I think is going to be one for another show. I'm not roping you into another show, but I mean, I invite anyone that might be listening, both live or after the fact, in case they want to join me on this. But definitely, it's come up a few times about, is there an inherent optimism to physiotherapy? Do we self-select for that? There's certainly something that we're overrepresented as fitness professionals, and the sort of sporting background that sometimes colours that culture, and those sorts of features aren't distinct from how that comes across and how that presents. To almost, there's like a brashness that sometimes comes across with that, or a boldness, or an enthusiasm, or an extroversion, and these aren't inherently bad by any stretch. But we also can't ignore the fact that if that is on aggregate overrepresented, then that is something that interprofessionally it matters. It might matter in certain patient circumstances, but also what I've just described as attributes might not be applicable in palliative care as they are MSK, because and sometimes we might select for that sensibly, and sometimes we might not, and we're siloing each other. So these conversations need to be had. I know that some of the tensions seem to occur when it comes to proposition of solution. I think that's one of the things that's interesting. But certainly, I think we can find common ground on analysis. And generally, it's too important to ignore. And your blog definitely spoke into something that's lit the touch paper on this conversation. So thank you so much for that. I'm so sorry we're out of time now, but if you could just tell people a little bit about where they can find you. We will link to the blog, but also anywhere else that they can find bits from you.
So I'm on Twitter. I'm trying to remember what my handle. I think I'm Gita Ramdharry on Twitter, and also I'm on Instagram, Dr. Gita Ramdharry on there as well.
Oh, fantastic. Well, thank you so much. I will make sure I link to the blog across social media. Thanks so much for joining me today. Really appreciate it. We've been meaning to do this for a while and just get our diaries together. So I'm glad we found some time.
That's brilliant. It's been a pleasure, Jack. Thank you.
Take care. We'll speak again soon, and make sure, if you haven't already, to get reading that blog and get thinking in that direction. That's exactly what it's for. Obviously, we want to hear your thoughts, but similarly, you know, these things are always best chewed over, I would say. So have a think, have a reflect, and let us know anything you might want to send to us. Of course, privately, if you don't want to be, say, tweeting about it and stuff, then we'll pass that on to Gita, and keep that conversation going behind the scenes if needs be. But for now, thanks a lot, and I will see you tomorrow.